For Māori, culture is the centre point of being connected. So for us it is about accessing our reo, our whakapapa, our whenua, our marae and our identity. It's central to our identity. So it's key to suicide prevention, as my research has shown in the past. Whanau's pivotal. Without the whanau, they can't have access to te ao Māori. The whanau will connect them back to their language, their whakapapa, their whenua, their marae. Without them, we don't really have a study. We need to make sure that they do become connected back to those things, to te ao Māori. And that's part of the protective factor. That's how we can bring them back to life. Well, when they present, they usually come through ED, so that's the starting point of data collection for us. So we find out when they presented, who they presented with, what they presented for, if they've presented previously, what they presented for then. So we find out if they have any mental health background. Then we'll go into further readings, more clinical notes and things like that. The doctors will have an exchange with them, not ours, not the researchers, in which notes are written up, discharge plans are developed, and that's where we come in and read all of those before we go and see them. Hopefully they're still in the hospital, in which we can engage them, start that engagement process face to face, but often they're not, and often they're out in the community again, so we need to use the phones and start eliciting information there. The problem-solving therapy is a well-known therapy. It's a therapy where the clinicians, the research clinicians, will help a person orientate their problem-solving to more positive ways of looking at things. They'll help them to define some of the issues that they're having, some of the problems that they're having, and then they'll send them away at the end of session 2 and ask them to have a look at some of those problems at home and come back with their workbook and to the next lot of sessions. And that's the karanga, the waiata process, in which they go away, they come back, and that can bounce backwards and forwards for up to around 8 sessions. But during that time frame, they're actually learning a way of problem solving for the future, for whatever problem that is, whether it's housing or getting a job or getting access to their whakapapa or reconnecting with their whanau. All those things can present as issues, and they come back and they run those ideas past the therapist or the clinician. We support them in a couple of different ways. We've got GP vouchers for them to attend a GP and have constant contact with a primary care provider. And we also have what's called postcards in te reo and in te Pākehā in English, and that they know that somebody still is out there and cares about them, and we're that person for the following year. And postcards have been shown to actually be quite a positive effect for those who've deliberately self-harmed in the future.